The parasympathetic nervous system is responsible for the rest and digest functions of the autonomic nervous system. Let's look at the structure of the parasympathetic nervous system first, and then we can go over the effects of both sympathetic and parasympathetic nervous systems. So just like the sympathetic nervous system, the parasympathetic also has two lower motor neurons. One is preganglionic, here in dark purple, and the other would be postganglionic and going out to the end organ. The preganglionic neurons will exit the central nervous system in the brainstem. The preganglionic neurons will exit the central nervous system in the brainstem through cranial nerves and the sacral spinal cord. Right? SC standing for spinal cord. So the cranial division, this would be the portion that is leaving through the brainstem, would be also traveling through cranial nerves. Right? Specifically, there are going to be 4 cranial nerves that you should be aware of. That would be the oculomotor nerve, the facial nerve, the glossopharyngeal nerve, and the vagus nerve. The sacral division of the parasympathetic nervous system, leaving through the sacral portion of the spinal cord, would be important for functions relating to urination, defecation, and sexual function. We'll address these functions shortly, but let's look at the organization of the neurons themselves. The preganglionic neuron and the postganglionic neuron meet in what are referred to as terminal ganglia. Terminal is referring to the fact that these ganglia are located very close to the end organ. Right? So for their location, that would be near the end organ. Okay, so I'm going to just put a little circle here really quick around this terminal ganglion, right? Going to the pancreas. Right, so that is where the dark purple preganglionic neuron is synapsing onto the lighter purple postganglionic neuron. This synapse between pre and post is a cholinergic synapse because acetylcholine is released by that preganglionic neuron onto the postganglionic neuron. And so that postganglionic neuron would have receptors for it, which are called nicotinic receptors. Right, and that's on the postganglionic neuron. Okay. All right, we can make a little note here that this is an acetylcholine synapse, right, or a cholinergic synapse. Okay, and so then we also need to look at the synapse between that postganglionic neuron and the end organ that is communicating with. And so that is also a cholinergic synapse, meaning that postganglionic neuron is going to be releasing acetylcholine onto the end organ. The receptor here, however, is different. This receptor that would be on the end organ is called a muscarinic receptor. Right, that is on the end organ. Okay, so just to see what we're talking about. All right, that would be, so our terminal ganglion for the stomach would be here between pre and post. This would be a cholinergic synapse, and this little light purple postganglionic neuron would have nicotinic receptors. This postganglionic neuron would then synapse onto the stomach here, which is the end organ, and it would release acetylcholine onto the stomach, and the stomach would have muscarinic receptors for that acetylcholine. Okay. All right, so now let's look at some effects of both the sympathetic and parasympathetic nervous systems. All right, and so oftentimes these are going to be opposing effects, especially for organs that are dual innervated, meaning they're controlled by both the sympathetic and parasympathetic nervous system. However, there are some organs and tissues that are not dual innervated, which we'll see, so they will only be affected by either sympathetic or parasympathetic. All right, and so just remember as we're going through these, the sympathetic nervous system has that fight or flight effect, so we can kind of use that to help us make sense of some of these functions. And the parasympathetic nervous system has the rest and digest effect. All right, so imagine for parasympathetic that you've just had a really big holiday meal and you are sitting on the sofa and you are resting and digesting. All right, so what effects, what would be going on in your body, right? That would be a parasympathetic effect. Okay. All right, so let's go through each of these, and we will start with the pupils. Okay, so this would be the opening in the eye that lets light into your eye to activate the retina. For the sympathetic nervous system, this would cause dilation of the pupil, making it larger. Okay, that would allow more light into the eye, right? You need as much light and as much visual information during a fight or flight situation as possible. The pupil is dual innervated, and the parasympathetic nervous system would cause it to constrict. That would be part of the resting part of rest and digest. All right, and then the sweat glands. So the sweat glands are not dual innervated. They are only activated by the sympathetic nervous system during a fight or flight situation, and that would obviously cause them to produce sweat. So the effect would be sweating. And then we're going to just put no effect here because it's not dual innervated. So the parasympathetic nervous system would have no effect. All right. Kind of conversely, the lacrimal and salivary glands are only innervated by the parasympathetic nervous system. So the sympathetic nervous system would have no effect. And the parasympathetic nervous system would stimulate these glands, causing the lacrimal glands, which are the tear glands, to produce tears, right? So an increase in tear production, helping to lubricate the eyes. And the salivary glands would produce saliva, right? So increase salivation, which would be important for the digestive part of that rest and digest. All right, and then we have the erector pili muscle that you learned about with the integumentary system. This is a small muscle in the skin that causes the hair to stand upright. It is only innervated by the sympathetic nervous system, and when it is activated, that causes goosebumps, right? Or like the hair standing up on the back of your neck, which you know is kind of a fight or flight type of response. All right, and there would be no effect for parasympathetic nervous system. All right, the adrenal glands are only innervated by the sympathetic nervous system. As we discussed with the sympathetic nervous system, the adrenal gland is directly innervated by a preganglionic neuron from that sympathetic nervous system, causing the adrenal glands to produce adrenaline or epinephrine, right? So the effect would be that it releases adrenaline into the blood, and so it can have systemic effects throughout the body. So there would be no effect here for the parasympathetic nervous system. All right, moving on down. Bronchioles. Okay, so with the bronchioles, these are dual innervated, so they're affected by both sympathetic and parasympathetic nervous systems. All right, and so the sympathetic nervous system will cause bronchioles to dilate, and the parasympathetic nervous system will cause them to constrict. So it makes sense that you would want them to dilate with the sympathetic nervous system, increasing the flow of air into the lungs and helping with oxygenation of the blood to get oxygen out to the tissues. Right, and that's less necessary when you're resting. Right, so they can be in more of a constricted state for parasympathetic nervous system. All right. Now, heart rate is a dual innervated function, right? So how quickly the heart is beating. Obviously, I think you could kind of figure out that for the sympathetic nervous system in a fight or flight situation, your heart rate definitely increases. And when you're resting and digesting and just sitting on the sofa, it will decrease. Right? It definitely doesn't need to beat as fast to supply oxygen to the tissues. And then veins, so the blood vessels carrying blood back to the heart are dual innervated. So this is referring to their diameter, right? Are they constricted or dilated? And so the parasympathetic nervous system will cause veins to dilate. And this will help to increase blood flow and decrease blood pressure, which we'll just put BP for blood pressure. And then the opposite would be true for the sympathetic nervous system. All right, so it would constrict veins, and this would increase blood pressure. Okay, and we have blood vessels distinctly in the skin versus the heart, right? And they're going to be kind of two different scenarios. And so in the skin, during a fight or flight situation with the sympathetic nervous system, blood vessels would tend to constrict. So this would make sense if you think about the idea that during a high stress situation, your body wants to get blood and oxygen to the vital tissues, which skin is not a vital for life type of tissue. It wants to get blood to like the heart and the brain and the lungs. All right, so we constrict the blood vessels of the skin so that you can redirect that blood to the vital organs that really need it during a stress situation. Right, and so they would be more dilated with the parasympathetic nervous system. So the opposite would be true with the heart, which is one of the vital organs. So the blood vessels in the heart for the sympathetic nervous system would dilate, and with the parasympathetic, they would constrict. Now, it's important to keep in mind when we say constrict with this kind of situation, we don't mean, constrict as in completely blocking off blood flow, but just more of a constricted state than with the sympathetic nervous system. All right. And so digestion, hopefully from what we talked about, this would be pretty straightforward. Digestion is promoted by the sympathetic nervous system. So the sympathetic nervous system, the parasympathetic nervous system will increase digestion, right? That is the digest part of the rest and digest. And digestion generally is inhibited by the sympathetic nervous system, so it will decrease digestion. Your body doesn't want to send energy and blood to the digestive organs during a high stress, fight or flight type of situation. Right? And that the same is also true with the bladder and the kidney and urinary functions. Right? So it is inhibited and decreased during a sympathetic response, and it is increased during a rest and digest parasympathetic response. Right? And then with metabolism, so for metabolism, think of ATP production. And so during a fight or flight situation, your muscles throughout your body need plenty of energy, so metabolism would increase, increasing the amount of ATP being made and sent to the cells that need them. And rest and digest for the parasympathetic nervous system is more focused on getting nutrients in and storing those nutrients and storing energy. So you certainly wouldn't want to be making a lot of ATP, right? So metabolism would go down and ATP production would go down a little bit, right? So think of the rest part of rest and digest. All right, and then finally, we're going to kind of talk about these last two together, generally as like sexual function. So sexual function is interesting when we're looking at the autonomic nervous system because it requires both input from sympathetic and the parasympathetic nervous system for proper sexual function. All right, so let's start with the parasympathetic nervous system. And so the parasympathetic nervous system with sexual function is responsible for the erection in both male and females, right? So erection of the penis and of the erectile tissue in the clitoris in females as well. And then the sympathetic nervous system is responsible for the orgasm part of sexual function. So for males, that would be ejaculation. And for female, that would be the female orgasm, right, which involves smooth muscle contraction. Right. Okay. So it's kind of a unique situation compared to the others that we talked about where the parasympathetic and sympathetic nervous system are actually working together for proper sexual function. Okay. All right, so our last topic for this chapter is pharmacology. And so we're going to take what we just learned with all of these different functions of the autonomic nervous system, and we can apply that to medicine in the medical field and different clinical implications. All right, so how can we use what we know about the neurotransmitters that are involved with these different branches of the nervous system and the effects of the two branches to help treat various issues that you might see in a clinical setting. Okay, all right, and so we can classify these different types of drugs as either enhancing the response of the autonomic nervous system or blocking or inhibiting it. All right, so our first category of drugs is a sympathomimetic drug. Okay, and so that's actually, right? These are also called adrenergic drugs, and that is because they increase sympathetic activity. All right, and so the name kind of tells you that, right? Sympatho telling you it's referring to the sympathetic nervous system, and mimetic referring to the fact that it kind of mimics the sympathetic nervous system. Okay, so this is going to be kind of working with the sympathetic nervous system or kind of activating the sympathetic nervous system. And the most common example of this as a drug is epinephrine. So epinephrine can be given as an injection. I'm sure you guys have heard of EpiPens. That's what this would be. All right, and so EpiPens are commonly kept on hand for people that have severe allergies, and so they're good for fighting off anaphylaxis from an allergic reaction. And that is in part because of that dilation of the bronchioles we talked about that's an effect of the sympathetic nervous system. And with an allergic reaction, the bronchioles constrict and swell up, preventing airflow. And so that would be an important, very immediate effect of an EpiPen. It can also be used to restart the heart. Right, get it pumping. And it can increase blood pressure, right? So a lot of vital kind of life-saving functions for sympathomimetic drugs. And then we can see drugs that kind of do the opposite, right? So sympatholytic, referring to the sympathetic nervous system, and lytic, meaning to disrupt or kind of break, right? So this is going to block or inhibit the sympathetic nervous system, right? So it will, let's just say block sympathetic nervous system, right? Sympathetic activity. Okay, and that's why they are referred to as anti-adrenergic drugs. Right, and so an example of this would be a beta blocker. Right, so beta blockers are very commonly given for anxiety. Right, and so the beta part of a beta blocker is referring to the beta adrenergic receptors we discussed with the sympathetic nervous system. Right, so this would be for the beta adrenergic receptor. Right, so beta blockers, just as their names tell you, would block that adrenergic receptor, preventing that kind of fight or flight response that can occur if somebody's having, anxiety or a panic attack at an unnecessary time. Right, so it can be good for anxiety. It can also be used to treat hypertension, right? So high blood pressure, right? So it can treat hypertension, right? So reducing the elevated blood pressure that you see with sympathetic response, right? And so we have similar types of drugs, but affecting the parasympathetic nervous system. Right, so the first category is parasympathomimetic. Right, so they're going to be mimicking or increasing the activity of the parasympathetic nervous system. These are also referred to as cholinergic drugs because we remember the parasympathetic nervous system has a cholinergic synapse onto the end organ. All right, so we're going to kind of be mimicking that synapse. So this would increase the parasympathetic activity. All right, so one pretty simple example of this would be nicotine. All right, so nicotine, not necessarily used in a medical scenario, but nicotine in like tobacco would have a parasympathomimetic effect. All right, so nicotine. Okay. Drugs that are cholinergic can also be used to treat problems like urinary retention. Right? So they can treat urine retention. So if somebody is having trouble urinating, you can use cholinergic drugs to help stimulate the bladder and the kidneys, right, and stimulate urinary function. It can also be used to treat, interestingly, dry eyes and mouth. Right? So somebody who's maybe not producing enough tears or saliva. Remember we said the parasympathetic nervous system activates those lacrimal and salivary glands. And so this could be a potential way to treat dry eyes, right? Chronic dry eyes and dry mouth. And then lastly, we have drugs that are parasympatholytic or anticholinergic. So these are going to block the parasympathetic effects, right? They're going to block parasympathetic activity. Okay. And so an example of this is kind of interesting to note because this is more of a side effect than a clinical implication, but morphine used for severe pain. A side effect of it is a parasympatholytic effect, right? That's a side effect of morphine. And so the most common result of this parasympatholytic effect of morphine is constipation, which is a very common problem with somebody who is taking morphine for pain. It's a tongue twister. Parasympatholytic drugs can also be used to treat low or slow heart rates, right? So preventing the parasympathetic nervous system from slowing down the heart rate, right? So they can be used to treat slow heart rate or bradycardia, right? And bronchial constriction. Right? right? And this would be in scenarios like somebody who has asthma. Right? So epinephrine, an injection of that would be more common for a life-threatening sudden constriction of the airways like you see with an allergic reaction. And you can use a drug like this, a parasympatholytic drug, to treat a more chronic condition like asthma where you see constriction of the bronchioles. Okay, well that is it for our autonomic nervous system chapter. Right, I'll talk to you guys again for chapter 15.